With about 5% positivity rate, Lagos remains the epicenter of the COVID-19 outbreak in Nigeria. Recent records from the health authorities indicate a downward trend in the figures of infection nationally, suggesting the curve being flattened. But that does not in any way suggest an end to the killer virus, which is now ravaging countries like India and
I
Brazil.
think it would be very unwise to think that we are not vulnerable to a third wave.
The development in those countries with deadlier variants has got the authorities in Africa's most populous country thinking on the need for precautions against the devastation that the third wave presents in the countries mentioned, as captured in a new travel advisory released by the federal government last week, which is already adopted and being strengthened by the government of Lagos, the country's economic nerve center.
This is a third wave that is devastating countries that have had significant second and first waves. So I think it would be very unwise to think that we are not vulnerable to a third wave and that a third wave would not cause as much damage as we're seeing on television in India, Brazil, and South Africa. So we're not prepared to take that risk. And as such, we are putting some very strict measures in place, and they fall along these five pillars. The first thing we're doing is that we're making sure that our testing is maintained. In addition to just carrying out the normal PCR test, we're developing the capacity to do the mutant PCR, which means it will not only pick up COVID, but it will be able to tell us which of the mutations are circulating in the world that anybody who is positive for COVID is now carrying in Lagos State.
More details of steps being taken to prevent the possible third wave forms a major part of the briefing by the Ministry of Health to herald the second-year anniversary of the current administration in the state.
And you can see from this pie chart that we're only able to reach about 40% of people who are inbound, and that we are not able to reach the remaining. So we are going to spend time ensuring that you are not able to give us a wrong contact number or a wrong address, and that we will put sanctions in place to ensure that you cooperate with us and that we can keep tabs of anybody that's traveling into Nigeria and ensure the safety of all Lagosians.
The first phase of vaccination has just been concluded. Close to 260,000 Lagosians were vaccinated and are awaiting their second dose. That can only bring about 1% herd immunity out of the 60% target if at least 14 million people get their COVID vaccine in Lagos. It is clear that there is a long way to travel for the state to keep safe from the changing virus.
So it's very easy to think that you're out of the woods. And certainly Lagos cannot afford to think that they're out of the woods. That is why we're so aggressive about our third wave mitigation strategy and the fact that we're going to keep pushing to vaccinate as many people in Lagos State over the course of the year and into next year to make sure we hit that 60% herd immunity, which is equivalent to 14 million Lagosians.
One key lesson from the outbreak of COVID-19 here in the state is the reality of the huge gaps in the health system. But the authorities say that has been a push to embark on an infrastructure overhaul to prepare the sector for even bigger future challenges.
Our secondary healthcare facilities have been in a very dilapidated state, in a very poor state of maintenance. And what we're doing now is we're taking about 5 or 6 every year and we're totally dismantling the facility and doing what we call a deep refurbishment. And you can see some images here. We're taking out the windows, taking out the doors, the roof, the bathrooms, everything. And we're strengthening the walls and putting in new fittings, new roofs, replacing the wood, pulling out all the plumbing and replacing them. And by the time we finish, these facilities will look like brand new hospitals.
Hopefully, the lessons of the first and second waves will be enough to prevent any further rise in the number of COVID infections, not just in Lagos, but across Nigeria. That, to a large extent, the authorities hinge on how much of cooperation they get from the citizens in the days and weeks ahead. Otumbo Oyetunji, Arise News, Lagos.